I have donated blood before, and this is me here talking to you, and I'm healthy, I've not died, all right? So you can donate blood as well.
Welcome to Health Plus, where we talk health and we talk life. I am Juliet Okofia.
Diphtheria can also affect the larynx, which is known as the voice box, which is in your neck.
For many men, sexual health is not something they find easy to discuss. Many people assume erectile dysfunction is simply a normal part of aging. But what exactly is erectile dysfunction? What causes it? Can it be prevented or treated? And when should someone seek medical attention? Today on Health Plus, we will separate facts from myths, as usual, with a medical expert. Did you know seeking medical advice early can lead to timely diagnosis and effective treatment? To help us, joining us today is Dr. Austin, Senior Medical Officer. Doctor, thank you for joining us.
Erectile dysfunction in men has to do with the inability for a man to attain and maintain erection for sexual intercourse. So, if a man is able to attain erection, is he able to maintain the erection for sexual intercourse? So, these are the things that are required for you to say a man is having erectile dysfunction. So the fact that you attain erection doesn't mean that you are not having erectile dysfunction. You have to also maintain the erection. Erectile dysfunction is actually on the increase. In men, erectile dysfunction usually common around the age of between 40 to 70 years of age. It can happen in all age range, but it's common among this age range. It usually peaks around 50 years of age. So there are different things that are actually attributing to all these. And these are actually attributed to, the increase attributed to the rise in which our youths are into drug abuse. So these are some of the things that makes us to start seeing rise in the population of men coming down with erectile dysfunction. And also because of other comorbidities that we are seeing. As we discuss further, we start seeing some disease conditions that we will have, and the patient will start having erectile dysfunction from their complications. Erectile dysfunction also may not actually have common signs and symptoms. The first time you might just notice it is when you are trying to initiate erection and it's not forthcoming. And Again, there are some persons, you feel yourself in the morning, especially early in the morning when you wake up, there's usually some persons who have erections, but sometimes you just notice that for somebody that has been having that, and you now start seeing that in the morning you're no longer having that erection. This is how it starts. You start noticing it. Then you're not trying to initiate erection in the presence of your spouse, and it's not forthcoming. That might just be the first time you just notice it. And you should, at that point, visit your doctor. It's awareness. Some persons are not aware that erectile dysfunction can be as a result of a disease in your body system. So you see some persons having the myth of that probably the wife is cheating on you in their place. When the wife is cheating on you, the man will be having difficulty having erections. And these are some of the things that are in the mindset of some persons. And they are not actually true. Some persons will also say that when you are having erectile dysfunction, it might be that the village people is having trying to cause a problem in the home or something. But that might not also be true. It's most likely will just be a disease condition that will need medical attention. It might be a disease condition. It can be from medications. There are some medications a patient can be on also that can cause erectile dysfunction. It can also be lifestyle modification. Kind of lifestyle somebody is usually like alcohol, smoking, all these are also here when we talk about erectile dysfunction. There are some disease conditions that a man will have, and we start seeing these complications. One of the complications is this erectile dysfunction we're talking about now. Disease like diabetes. When a patient having diabetes and is not well controlled, the patient can start coming down with complications like erectile dysfunction, because diabetes has a way of destroying the nerves, especially the sympathetic nervous system. Meanwhile, erection is only on the parasympathetic nervous system. And so when this are destroyed, when it's affected, a patient can start having erectile dysfunction. The first time a patient might just be coming to be aware that he's diabetic might just be from erectile dysfunction. Having erectile dysfunction and visiting the hospital, they also want to investigate further what's the cause of your erectile dysfunction, do an investigation, and discover that the patient is diabetic. That might just be the first time you notice that the patient is diabetic. So it is a complications that can arise from poorly managed diabetes. Again, hypertension. Hypertension, when not properly managed, can also cause erectile dysfunction, because the hypertension can start affecting the blood vessels that are responsible for that erection. So when these blood vessels are destroyed, the integrity of the blood vessels starts failing. So erection is not achieved when it is demanded. Most cardiovascular disease are issues we also look at. Most cardiovascular disease, even obesity, is also a problem that we can be looking at when a patient is having erectile dysfunction.
Now, let's hear the Benin City residents what they know about this men's health challenge, erectile dysfunction.
Some of the causes are it has to do when one is aging, that is from 40 years and above. Two, when one has medical challenges. Three, one's lifestyle.
Erectile dysfunction in men can be caused through habits that are not conducive for the body system to function properly, like smoking, excessive intake of alcohol, and the inability of a man to rest adequately. If you don't rest enough, all this will affect the proper functioning of the body, especially in the area of procreation. Balanced diet, because it is what you eat that we are what we eat. So if you don't eat well, not just taking carbohydrate back to back, but you eat food that will give you the nutrients that the body desires.
We have heard the public opinions, and what next?
A man should seek medical attention for erectile dysfunction immediately you notice it. Immediately it is noticed. When you notice you are trying to stimulate erection and you are not getting it, you should immediately see your doctor. Well, erectile dysfunction diagnosis is usually clinical. By the time you take your history, physical examination, you would most likely arrive at a diagnosis. But however, there are some investigations that are important. You want to know where the problem is coming from. Not to actually make the diagnosis, but to know the cause. Take, for example, you want to know how potent is the blood vessels around there. There might be need for penile Doppler scan. By the time you do a penile Doppler scan, you know the integrity of the vessels around that area. So you may now know where the problem is coming from. So there are also some investigations you may like to do. Fasting blood sugar, urinalysis, glycosylated hemoglobin. That will tell you how well your sugar has been controlled for the past 3 months. So you may be able to make a diagnosis of diabetes in such situation. Again, you may also want to carry out some other investigation to know the integrity of the blood vessels, to know how good the heart is functioning. Is this patient hypertensive? These are some of the investigations you may need to do to actually arrive at a diagnosis of what's causing the erectile dysfunction. Patients that is having erectile dysfunction, like I said, will want to investigate and know the cause. So by the time you know the cause of erectile dysfunction, you can treat adequately depending on the cause. A patient is diabetic, you manage the diabetes. By the time you start to manage diabetes, if the extent of damage to the nerves is not that bad, the patient will start to recover. So if it's hypertension, manage the hypertension. If it's medication that is causing it, withdraw the medication and discover that the erectile dysfunction will be resolved. So managing erectile dysfunction depends solely on the cause of the erectile dysfunction. If it has to do with depression, you manage the depression. If the patient needs to see a mental health physician, you counsel the patient to see a mental health physician so that that depression can be adequately managed. There are some medications we use, but that medications should not be taken without a doctor's prescription, because the medication on its own has some dangerous side effects. So a patient that is already having serious cardiovascular disease going to take such medication will put the patient's life at risk. Because we've had situations where a patient will just be rushed in and we examine the patient is already dead. Why? You took that medication because you want to achieve erection. And in the course of sexual intercourse, you just have cardiovascular arrest. So that medication should actually be prescribed by a medical doctor after taking detailed history of the patient and examination. And you now know that this medication will be good for this patient. And even when that patient is taking that medication, should also be under close monitoring by the doctor. Well, most of the time, management will resolve it. By the time you manage it with all these things I've talked about, the erectile dysfunction will be resolved, provided the cause have been known. So when the cause is known, you manage it adequately. Most of the time, it's resolved when it is well managed.
Otherwise known as a worker.
This is Health Plus. Today, searchlight on universal healthcare. What does it mean?
Fatal. It's good to sing praise unto our God, for it is pleasant and praise is comely.
Hello and welcome to another exciting episode on Youth Arena.
Hey there, welcome to another exciting episode in Top 7 Jams. It's your girl Pearl. You are watching NTA Benin, Channel 7. For your breaking news, program sponsorship and participation, contact our marketing department. Follow us across our social media pages on Facebook, NTA Benin 1, on Twitter, NTA Benin 1, on YouTube, NTA Benin.
times when a man is having erectile dysfunction, like I said, depression can cause erectile dysfunction. So also erectile dysfunction can cause depression, because a man wanting to have sexual intercourse with a wife and is not able to, that self-esteem will come down and the man will start to think. And the man, many people will say when that part is dead, the man is dead. Because that part of a man is very important. And if it's not working efficiently, the man tends not to function adequately, even in his place of work and whatever he's doing, because he's not going to be happy. So that is the reason why it should be managed adequately when this issue arises. When this erectile dysfunction comes up, the couple should sit down and discuss it among themselves. It is not the time to apportion blame, but it is a time to handle the matter maturely. Know where the problem is coming from. Counsel your husband. Let's visit a medical doctor so as to make the right assessment and adequate treatment. And when this happens, you discover that the person will become happier again once more. Erectile dysfunction and infertility are things that are amongst us. They are disease that happens to a man, and it is not something that cannot be treated. They are disease that can be treated. So when a man is having this disease, it is not the time you start to apportion blame to the man. It's a time you sit up, have a good discussion, arrive at a consensus to see your medical doctor and follow up with the treatment. The doctor says, stop this lifestyle, you stop it. Stop this medication, you stop it. Take this, you take it. And by the time you do all this, you discover that something good will come out from Nazareth.
Still tell a huge thanks to the doctor for sharing such valuable insight with us today. Remember, erectile dysfunction is a medical condition, not a personal failure or a spiritual problem. Avoid self-medication and unverified herbal products. Join us next Sunday by 11:30 a.m. and Wednesday 10:30 a.m. for a repeat. Also, contact us on Facebook and YouTube at NTA Benin Health Plus. We remain committed to bringing you reliable health information that empower you to make informed decisions. Always remember to follow your doctor's advice. I am Juliet Okofia. Thanks for watching and have a healthy week ahead. Bye-bye.